But even as the country absorbs the shocking spike in the number of cases, what is even more worrying for the government is the spread of the infection in the populous Kibra slum, whose numbers are inching towards the 100 mark. Enock Sikolia went to Kibra to find out what could be pushing up the numbers.
The past week in Kibra has seen a sharp rise in coronavirus cases, a day after 15 people tested positive to the zoonotic virus. Kenya's biggest informal settlement registered 13 more cases on Thursday. But Kibra's COVID-19 story does not end here. All the 7 positive cases found in the county of Siaya on Thursday are directly linked with travel from Kibra.
Somebody in Kibra, without the authority to authorize anybody to travel, signed a document that allowed and was respected by police all the way from Kibera, taking mourners for a funeral in Siaya. The mourners themselves were positive.
Citizen TV has established that the authority given to the 7 to travel was signed by a chief from the slum area. Positive cases here are almost hitting 100, and the government is concerned. It's trying to establish factors fueling the spread, but one does not need a microscope to see why Kibra has become a hotspot. Here, they still operate in total disregard of directives issued by the government. Changa and Busa dens are operating as if COVID-19 isn't a reality. Secretly, and using hidden cameras, we sneaked into a famous Changa den in Serangombe area of the vast slum. We started from the open area, and the number of people with tins filled with changa is overwhelming and shocking. A majority had no face masks, and those who had lowered them to have a drink. But then there is danger. The distance between them is too close to prevent droplets from jumping from one's mouth or nose to the mouth, nose or eyes of his neighbor. The virus only needs one to infect millions. We moved from one room to another, and the picture was worrisome. This room had many more people partaking the brew. Now let's look at these pictures with a keen eye. We noted one tin being used by several people, including the brew distributor. Some even shared drinks without realizing the danger staring at them. Along the alleys, it's not hard to identify those already drunk.
Mimi kama sijakunywa ziongeangi. Mimi naitwa Mama Karo. Golana gani? Golana gani? Hakuna golala hapa.
But Kibra is a complex story. Regan is a healthcare worker on the forefront against COVID-19 in the slum area. He says to curtail the virus from spreading, the government must ensure sufficient water supply and sanitization. He further says sensitization must be given priority.
The number of COVID-19 cases are on the rise here in Kibra, and community leaders are now blaming the police. They say they are the weakest link in the fight against the fast-spreading virus.
If you are a police officer, you are mandated to do your work. You find a police officer is walking along these corridors, collecting money. Why?
As it is, the largest challenge is social distancing. Because again, we have to admit that the community we serve in, social distancing is a bit difficult. But all the same, we should need to reinforce the idea of wearing masks. So these two, when they're not well observed, it becomes a huge challenge, and that explains why the cases are on the rise every day.
The reality is that very few people in Kibra wear masks, and whenever they sit in numbers, social distancing is given a backseat.
You are told that there are 13 cases in Kibera today. It is not the same. You cannot behave the same as somebody in Moasabit, where perhaps there is no case of, or somewhere else where in the 20 or so other counties that have got no infections. It is not the same.
But for some, the government must do more than warnings to ensure Kibra is a safe population. Enock Sikolia, Citizen TV.